Hello, thank you for joining us. Today, we'll be talking about a survey of the childcare sector in Minnesota that we and First Children's Finance conducted last month. My name is Tu-Uyen Tran, and I write about the regional economy for the Minneapolis Fed. I'll be facilitating this event. As a dad, childcare is a personal issue for me. I have a 7-year-old and a 4-year-old. We've had many wonderful childcare providers over the years. I think a lot about what they do for us, allowing my wife and I to work and earn a living and educate our kids. Many other families, other workers, depend on childcare providers to be able to earn a living. At the Minneapolis Fed, we see that in our research, and we hear that from the public. A lot of employers depend on childcare providers too, because employers depend on parents to show up for work. The childcare sector is just so important to the economy. The findings of the survey will be presented by Suzanne. Suzanne is an expert on the business side of childcare at First Children's Finance. Based in Minneapolis, First Children's Finance is a nonprofit and a community development financial institution that provides business training, consultation, and financing to childcare providers. First Children's also helps communities come together to ensure that childcare is available to support their local economies. For the next 20 minutes or so, Suzanne will be presenting findings from our survey. We've set aside the last 5 minutes for Q&A. Please use the Q&A box at the bottom of your Zoom app to leave a question at any time. I'll be tracking those, and we'll try to answer as many as we can. Before we get started, I need to go over a few things. First, my views and Suzanne's are our own and do not necessarily reflect those of the Federal Reserve Bank of Minneapolis, the Federal Reserve System, or the Board of Governors. Second, slides for this presentation and a copy of the video will be emailed to register attendees later this week. We would also love to get your feedback at the end of this presentation. So please take a moment to fill out the brief 3-question survey at the end of the webinar. Again, thank you for joining us today. Suzanne, over to you.
Thank you, Tu-Uyen, and good afternoon, everyone. Before we get into the survey results, we'll share some detail about exactly who answered our survey. As we have every year, we received a fantastic response from the childcare provider community. So I'd like to thank any childcare providers who might be listening in today or who might view the recording later. With regard to provider type, our survey respondents are a fairly reflective breakdown of statewide provider types, with a slightly higher representation from family providers. With more than 1,200 responses, this survey represents roughly 16% of licensed childcare programs in Minnesota. Currently, there are about 7,800 licensed childcare providers in Minnesota. Just under 6,000 of those are licensed family childcare, and about 1,800 are childcare centers or other programs. The other category here would be Head Starts, preschools, or after-school programs. One important note here is that when we first conducted this survey in 2021, at that time, there were 7,500 licensed family childcare providers in Minnesota. So in just 3 years, we've lost 20% of our licensed family childcare programs. The number of childcare centers has risen during that time from about 1,500 to about 1,800, and that does help with capacity. However, childcare centers are more likely to be located in larger population centers, and the loss of family childcare programs is problematic for a lot of communities. Our regional breakdown is also fairly consistent with statewide licensing data, with Greater Minnesota slightly overrepresented in this survey. And when we say metro or Twin Cities during this presentation, we're referring to the 7-county metro area. Of those providers who chose to report their racial ethnic identity, 6% identified as racial and ethnic minorities, and 78% identified as white. Minnesota does not release data on the demographic diversity of childcare business leadership, but this breakdown from what information we do have seems pretty close to actual. And one thing to keep in mind is that our survey went to childcare business leadership, family childcare providers, or center directors and owners. The broader childcare workforce, which includes classroom teachers and teachers' aides, is a much more diverse group. Finally, you can see from the information to the right, the vast majority of our respondents, 89%, are women. Let's see what we found out this year. In this year's survey, we asked childcare providers to tell us how their enrollment lined up with their license capacity. As many of you know, the childcare sector is regulated by the state through licensing. There are statutory limits on how many children of different age groups providers can care for. Childcare programs must comply with these ratios to stay in compliance. Because childcare programs must always be mindful of the balance of ages of kids in their care, it's fairly difficult, particularly for childcare centers, to maintain 100% enrollment as kids of different ages age in and out of different classrooms throughout the year. Realistically, most childcare programs operate at about 85% of capacity. We've broken this information down by provider type on the left and by region. You can see that centers statewide are operating at about 66% of licensed capacity, which is below capacity and could be due to a number of factors. Later in this presentation, we'll look at staffing issues and trends in the market to explore that. Family childcare providers in our survey are operating close to 80%. So the respondents to our survey, at least, are operating fairly full programs. Looking at the regional breakdown, which includes all provider types, childcare centers in the metro are about 70% of capacity, and programs in greater Minnesota are at 83% capacity. And recall, this is all provider types in greater Minnesota operating very close to that 85% of operational capacity. This won't be a surprise to many people. It's a good illustration of how few available childcare slots currently exist in greater Minnesota. We've been watching childcare enrollment levels for the past few years, and the good news is that we are starting to see that enrollment levels are starting to stabilize across the sector. Enrollment is the number of children signed up at a given childcare program, and enrollment equals revenue. So stable enrollment means stable revenue, and when it's unstable, as it certainly was during the pandemic, the financial health of a childcare business is at risk and providers lose money. But we started to see enrollment become more stable last year, and that has certainly continued this year. The gray and blue areas on this chart show either stable enrollment or increased enrollment, and the majority of childcare programs, both licensed family childcare and childcare centers, reported stable or increased enrollment during the last year. There is something interesting with childcare centers, however. The bottom two bars show childcare center enrollment, and the orange color represents decreased enrollment. You can see that more centers this year over last year report decreased enrollment. We just saw that childcare centers are operating at about 63% of their licensed capacity. So let's take a look at some data that might shine a light on that. This year, we wanted to get a better idea of what childcare providers are learning from the families they serve, particularly those who may be taking their children out of childcare. We asked providers if they had direct information from families about why they were leaving childcare. The blue lines here are responses from childcare centers, and the orange lines are responses from family childcare providers. First off, let's look at a difference between centers and licensed family childcare at the bottom of the table. Only 5% of center respondents said that no families left their program last year, but more than 40% of licensed family childcare reported that no families left their program. Moving back up the table, 49% of centers said that families moved out of their geographical area, and only about 10% of family providers reported the same. We've got some interesting indicators about affordability here, too. More than 50% of centers had direct knowledge of families leaving their program because they couldn't afford care. And just over 30% told us that families left because parents left the workforce and no longer needed childcare. One last point on this slide. In last year's survey, we had a lot of providers comment that they were concerned about the increase in school-based programs and families leaving both centers and family childcare programs to move their children to school-based programs. We were interested in learning more about that and wanted to see if we could capture qualitative data. In the middle of this chart, we see that 13% of centers and 18% of family programs reported direct knowledge of a family leaving their program for a school-based program. To be clear, there is a shortage of childcare availability in Minnesota, and it's a good thing to create more childcare slots across many different care delivery types. We hear from providers, however, that they are at a competitive disadvantage as school-based programs often have lower overhead and operational costs because those can be shared with schools. More importantly, though, school-based programs mainly serve older kids, preschool and school-age kids. Due to licensing ratios, the cost to care for older kids is much less than it is to care for infants and toddlers. We had a lot of quotes and comments from providers in this year's survey that they won't be able to stay open to serve infants and toddlers if they're not also able to care for older children in their programs to balance out the costs. This is a data point we'll continue to watch. We also wanted to look at any differences in the childcare market between the Twin Cities and Greater Minnesota. The rate of responses to the affordability questions, as well as to families leaving the area, are much higher in the metro. And if you look at the bottom of the chart, many more providers in Greater Minnesota report that no families left their program, which could get back to what we saw earlier with the lack of availability of childcare in Greater Minnesota. Another interesting difference here is parents working remotely. About 20% of providers in the metro reported families leaving their programs because parents had the ability to work remotely and didn't need childcare. And that number is much, much lower in Greater Minnesota at 3%. Remote or hybrid work levels have changed drastically in the past few years, so it will be interesting to watch this indicator as the work from home situation settles across the state's workforce. While this survey included both childcare centers and licensed family childcare programs, for these next few slides, we're going to talk specifically about childcare centers, and more specifically about staffing and how that impacts childcare availability. For the past couple of years, Minnesota's labor market has been extremely competitive and extremely tight. Childcare centers, like many businesses, have had difficulty hiring qualified staff. We're showing responses to this question over the past 4 years, asking how easy or difficult it has been to find qualified employees. You can see how colorful the left side of this graph is to indicate very difficult when it comes to finding staff. But we do see some improvement here as the blue lines representing 2024 get slightly larger over previous years as you start to look to the right. This year, we even had 2% of centers saying hiring was easy and 1% saying very easy, and that's pretty great. We've all heard a lot about how childcare is not a well-compensated job. Our organization did a childcare cost modeling report last year that showed that family childcare providers' average annual revenue is equivalent to just over $8 an hour in rural areas and $17 an hour in urban areas. Our hourly salaries for teaching staff at centers across the state range from $13 an hour to $19 an hour. During COVID, Minnesota used pandemic-related federal funds to provide support to childcare programs to supplement compensation. And last year, the state decided to continue that program on an ongoing basis using state funds. The Great Start Compensation Support Payment Program began last fall, and that has been a very welcome financial support for this workforce. We asked centers what compensation incentives they were able to provide to staff during last year. The second bar shows that 85% were able to offer an hourly wage increase, likely linked to the Great Start payments. There is also a high rate of paid time off, discounted childcare, and bonus pay. Critical benefits, though, such as health insurance and retirement plans, are offered by only slightly more than half of childcare centers. This could certainly be an area that is impacting difficulty in hiring. And what does it mean when a center can't hire staff? As I mentioned earlier, the state limits how many children of different age groups can be cared for or educated by an adult. A center may be licensed to care for, let's say, 75 or 100 kids, but if they don't have enough staff in place to meet the ratios required for each age group, they can't operate at their licensed capacity. Over the past couple of years, we've seen many centers operating with empty classrooms. They have the space, they just don't have the people. Those empty classrooms, those unfilled childcare slots, are the result of difficulties in hiring or retaining staff and have a real tangible impact on the availability of childcare for Minnesota families. Last year, we showed how open teaching staff positions at centers equated to unavailable childcare. Those blue lines on this chart show unfilled childcare slots across the metro and greater Minnesota and specific regions. The orange lines are responses from this year's survey, and you can see that there are much fewer unfilled slots reported this year due to lack of staffing. While that is a positive improvement, a good chunk of center respondents this year, 42%, reported that they had to limit enrollment due to inability to find staff. Specifically, those centers reported more than 700 open teaching positions, equating to more than 2,000 unavailable childcare slots across the state. Recall that our survey respondents make up about 16% of the childcare sector in Minnesota. So if these are the real numbers just out of our survey respondents, it's safe to assume the actual number of unfilled childcare slots due to lack of staff is much, much larger. Shifting away from staffing and compensation and looking back now at both childcare centers and family providers, let's look at revenue. I talked about enrollment earlier, and that enrollment is the main driver of a program's revenue through tuition. Every year that we've done this survey, we've asked whether providers increase tuition. You can see in 2021, 22, and 23, a steady increase in childcare centers reporting raising their tuition. That number actually went down a bit this year, but still 59% of childcare centers reported raising their tuition. Licensed family childcare, represented here in orange, also show an increase over all 4 years. We know that during the pandemic, family childcare programs were less likely to raise tuition. You can see that in the first 2 years. But in the past 2 years, the percentage has gone up, with about half of family childcare providers raising their rates last year, which is closer to the number of childcare centers that raise their rates. While most childcare revenue comes from tuition, which can be private pay or supplemented through programs like childcare assistance payments, also known as CCAP, or early learning scholarships, there are different types of grant supports available as well. You can see that about 90% of all childcare providers in our survey report participating in the new Great Start Compensation Support Program that I mentioned earlier. So you can see how many childcare businesses are relying on the continuation of that program. A good number of providers have been able to access other grant programs as well. You can see, though, that centers report a much higher rate of accessing available grant programs, which isn't too much of a surprise given their organizational structure, which usually includes some administrative support. Family child care providers, on the other hand, are their own administrative support and can have more barriers to accessing capital. The exception here is the Facility Revitalization Grant Program, with a more equal rate of access between family programs and centers. We wanted to know what other steps childcare businesses might be taking to manage their cash flow. You can see that many providers reduced expenses last year, and many resorted to reaching into their business emergency funds. Around 15% of all providers reported accessing a business emergency fund last year, and around 5% took out a business loan. But we see here how many childcare providers also rely on their personal finances to cash flow their businesses. More than 30% of family providers said they had to use either personal savings or even retirement funds last year. And high interest financing remains troublingly common. Our survey framed high interest financing as credit cards or payday loans, and 20% of family providers report using high interest financing. This is down from about the 24% from last year, but that's still a disturbing number. We also asked whether providers were unable to pay themselves at times. 15% of center directors and 23% of family providers said yes, they were unable to pay themselves at times last year. Following that same line of reaching into personal savings or foregoing a salary, we have some information about how many childcare providers report that their business has an impact on their household income. Like most small business owners, childcare business owners often find that the financial health of their business is entwined with their personal finances. It's common knowledge that running a small business is a tough undertaking. I actually attempted to start a business myself about 15 years ago, and I lasted less than a year. It's really tough. So a business impacting a business owner's personal finances maybe isn't so much of a surprise. This slide shows the answer to this question over all 4 years of the survey. There has been a steady improvement here for childcare center owners and directors, but even with that improvement, this year there are still a quarter of center directors or owners reporting an adverse impact on household income. And you can see that the yes answers to this question is even higher for family programs, with more than half of family providers reporting an adverse impact on their household income every year of the survey. The response rate actually went up slightly this year to 55%. Again, it may not be all that uncommon for small business owners to experience this, but I'm really curious how the childcare sector compares with other industries when it comes to this question. Childcare is a majority women-owned business. The pay is low, the hours are long, and as we have seen, the profit margins are thin to negative. Yet the childcare sector provides a service that is essential to the state's entire workforce. If the childcare sector fails, the rest of the economy follows. So I think we need to consider how much of a personal financial risk we are asking childcare providers to continue to take so that other businesses can access a workforce. So with all the financial difficulties that can go along with owning a childcare business, each year we've asked childcare providers how long they thought they could stay in business. And this year, we've actually seen some improvement over last year, particularly from childcare centers, with more than half answering that they believe they can remain open indefinitely. The not sure response, or those who aren't sure they can stay in business, sits at around 30% for all providers. This is actually also an improvement over last year, when it was closer to 50%. For our last 2 slides today, I'd like to share something new that we started with this year's survey. We wanted to see if we could more qualitatively capture how childcare providers feel not only about their business finances, but about the childcare sector overall and about support for the sector. So we presented some statements and asked if providers agreed. You'll see that there are some differences based on provider types, with childcare center directors or owners and licensed family childcare providers perceiving some of these issues very differently. The first statement is, Minnesota is investing to increase childcare subsidy for low-income families. 80% of centers said yes, but only 44% of licensed family childcare agreed. Interestingly, the percentage comparison is nearly the same between the 2 provider types when they are asked whether they accept childcare subsidies. We asked if providers agreed that Minnesota is providing support to increase wages. 70% of centers agreed, but only 35% of family providers agreed. Less than half of all providers agreed that Minnesota is effectively investing in childcare facilities. And when asked if Minnesota investments are increasing the sustainability of childcare businesses, almost 60% of centers said yes, and 41% of family providers agreed. And the last category here is interesting, with nearly 70% of family providers showing concern about tax implications of government funding. We think this gets back to how much family childcare programs can be entwined with personal finances. Continuing with these opinion statements, 86% of family providers and 64% of centers agree with the statement that the childcare sector is in crisis. Many of us working in this area have talked about the sector being in crisis, but it's interesting to see how many childcare businesses themselves agree with that statement. And while a good majority of all childcare providers agree with the statement that the sector is in crisis, once again, we see a difference in the percentage of center respondents and family provider respondents agreeing with that. One area where they definitely agree, though, is on pay. Fewer than about 10% of all providers agree that childcare workers are paid fairly. There is, again, however, a difference across provider types as to whether that compensation is improving. But with all that, there are some seeds here of optimism. More than 60% of center owners and 45% of family providers are optimistic about their business. With everything that this sector has gone through and continues to go through, that's a note of positivity about the future. While the business side of childcare can be a real struggle, we hear all the time from childcare providers that they love their work. They love the kids in their care and the families they serve. And they understand very well how important childcare is, not only to those families, but to the rest of us in Minnesota and to the health of our state's economy. Let's hope we see that number rise when we ask again next year. With that, Here's contact information for both Tu-Uyen and myself, as well as First Children's Finance and the Minneapolis Fed. Please feel free to reach out to either of us directly with any questions you might have. We have time now, I think, for a few questions.
Yes, we do. So if you have questions, please type any of them in the Q&A box on Zoom, and we'll try to get to them. But I guess I'll start with this one. Suzanne, last year, the state of Minnesota made a huge investment in childcare. Are we starting to see any of the effects of that investment yet?
We are starting to, I believe. The most obvious one that we talked about in this presentation is the continuation of what were the child care stabilization grants into the Great Start compensation support payment program. And you can see that 90% of providers are accessing that. It's basically a monthly support payment to help pay for childcare worker compensation. I don't think we're seeing yet some of the other investments, such as the raise in CCAP rates, but we're hoping that in next year's survey we may see a little more of that.
Well, here's another one. What finding from the survey was most striking to you?
Well, there were a few. And I'm going to feel bad to say this, but the level of optimism, even if it's just at 60% of centers saying they're optimistic about their business, I think is great. And almost half of family childcare providers being optimistic about their business, I think that's something. I'm not sure we would have seen that level of optimism, such as it is, if we'd asked this last year, and definitely not the year before.
Okay. Here's another one. Did your survey gather info about what providers are charging for care? This person is trying to figure out the affordability angle.
Yeah, we didn't capture that in this survey, but there are a few reports that have been released in the last year and will continue to be released through the Department of Human Services. If you want to get in touch with me directly, I can direct you to the correct report.
Okay. Here, another question. Based on the qualitative answers, were you able to gain insight as to why family child care providers expressed that they did not feel like the state was effectively increasing their compensation?
That's a good question. When you're talking about family child care, I think family child care providers perceive compensation a little bit differently because it's basically revenue. They don't, by and large, pay themselves an hourly rate with a paycheck. So it all goes into the business. So it's harder to see that increase just because you've got, your revenue coming in, and maybe at the end of the year, you'll look at your annual revenue. That's my best guess at that answer.
And another question, I think this might be the last one since we're running out of time here, but given the supply difficulties to childcare provision, are you seeing or hearing any increases in care centers sponsored and run by businesses who might need it for their employees?
Yeah, we hear a lot of interest in this. A lot of companies are saying, hey, I want to retain my employees. What can I do to get a childcare center on site? What happens often is they start looking into it and they think, ooh, I'm not sure we want to take that on because I'm not sure we can actually make this make sense financially. What often happens, though, and we do this a little bit, is matchmaking between a specific employer and maybe an existing program, maybe a set of family childcare programs in their community or a center in their community who might be willing to kind of hold out or reserve childcare slots for that company.
Okay. Well, that's our last question for today. Thank you all so much for joining us. More information, including the link to the video and the slide, will be on our follow-up email to this event. So look forward to that. Please remember to fill out the brief 3-question survey that will pop up in your Zoom window upon exiting. And have a great day. Thank you so much.